I want to share something that really aligns with the Tongue Tie Expert's mission, supporting breathing, sleep, and airway function. Remplenish creates simple, science-backed tools to do exactly that. Their myo-nozzle turns something you already do every day, drinking water, into gentle resistance training for the tongue, mouth, and throat, supporting nasal breathing, tongue posture, and overall airway health. If you snore, wake up tired, or struggle with mouth breathing, your airway muscles might need a little more support. Remplenish is an easy daily habit that can help you breathe better at night, sleep deeply, and feel more like yourself during the day. Visit their website, remplenish.com, and get 10% off your first order by signing up for their newsletter at the bottom of the site. See the link in the show notes. Welcome to the season marking 4 years of the Tongue Tie Experts podcast. I'm incredibly grateful for what this space has become. What started as a simple idea to create thoughtful, evidence-based, and multidisciplinary conversations about tongue tie, infant feeding, and airway-centered care has grown into a global community of professionals who are committed to doing better for babies and families. Over the years, I've had the honor of sitting down with parents, lactation consultants, dentists, birth and medical professionals, therapists, researchers, and educators from around the world. Together, we've explored the science, the controversy, the clinical nuance, and the very real human stories that live at the heart of this work. My hope has always been that this podcast supports you in thinking critically, collaborating confidently, caring more deeply, and helping more people. If you're new here, welcome. I'm so grateful that you found us. To those of you who have been listening, sharing episodes, and sending messages over the years, thank you. Your support is the reason this podcast continues to grow. To our guests and sponsors, special thanks to you for your incredible contribution to this mission. Let's see how long we can keep this going. Please click, follow, leave a rating or review, and share with a colleague. It truly helps this podcast reach more who need to hear these insights. Now, let's get into today's episode. Hi, everyone, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I'm joined by Dr. Neel Bulchandani, an integrative specialist and chiropractor who brings a unique whole body perspective to the work we do. He's the creator of functional mandibular diaphragmatic integration, or FMDI, and we're going to talk about that. It's an approach that connects what's happening in the jaw and mouth with the rest of the body to help release tension and improve function. Dr. Neel works closely with families and professionals and is often a go-to provider for pre- and post-release bodywork. He collaborates across disciplines and has helped many babies and parents experience more ease with feeding and overall function. He teaches his work to providers around the world and sees patients both in California and virtually. Welcome, Dr. Neel. It's a pleasure to have you here. Long time coming. We've been trying to connect for a bit, and it's so good to finally get to chat with you.
Yeah, Lisa, thank you so much. It's a privilege to be on the conversation on your podcast with you because I've been a fan. So many episodes that I've really enjoyed.
Thank you so much. And I cut your bio short, and I didn't put in your personal stuff, but you're a married man with kids. So tell us about your family. That's important too.
Yeah, my wife, Dawn, she's about a week from defending her dissertation. She's got 3 master's degrees, is about to get her PhD. She's a poet. She's funny. She's brilliant. And her name is Dawn. And then we have 3 kids, 9, 7, and 5. Serenity is the oldest. It's a girl. And then Cypress and Zephyr. And yeah, we're loving it. We moved a year ago here to Santa Barbara, California. And we were in Reading, which is at the top of the state.
Mm-hmm.
So we've been loving it, and we're just,
Mm-hmm.
really thankful
So
as
I
a
love their
family to be.
names, beautiful names.
Mhm.
And you've got your hands
Yeah.
full with 3 little ones and a very smart
Yes,
wife.
absolutely.
Very smart wife.
Absolutely.
So tell me, Dr. Neel, as a chiropractor, how did you get into this specific work? Because you could go in any direction. You could be a general chiropractor. You can, there's lots of directions. How did you find yourself thinking about oral restrictions and where that led you?
Yeah, I was, graduated almost 18 years ago, started practicing in Illinois, and then, um, was following intuition, working on cranial bones. Had so much exemplary training and experience, but really, it was my daughter being born with a tongue tie 9 years ago. Midwife, who's amazing, told us, your daughter has a tongue tie. And like right away, we're like, oh, I had no idea what that was, that it existed. So that's my origin story is, thankfully, even though those first 2 weeks felt like years with
Mm-hmm.
like painful breastfeeding for my wife and seeing Serenity just take in so much air and all the belly distension, we tried a lot of really great forms of body work for her. And thankfully, we had good friends also who said, you know what, check out this article, Dr. Carey's Scissors versus Laser. They told us about a frenectomy. They told us about a tongue tie release procedure. Our midwife mentioned it, but we wanted to do a little, digging in and research. And it was 2 weeks later, she had her laser frenectomy with Dr. Shervin Yazdi, who, is
Mm-hmm.
also a presenter at the Breathe and Thrive Symposium and other places. So he made it a night and day experience for our daughter, that she had so much relief from that it was a pretty profound experience. But it was kind of one of those door opening, okay, and then the story begins, because there
Mm-hmm.
was so much to the post-op care and the body work that she needed in order to really appropriate the effects of that release. But that's where it all started for me, was 9 years ago when my
Yeah.
daughter was born.
I should start keeping account of how many professionals I have interviewed who tell me that their stories
Yes.
started with their own children, which just
Yeah.
goes to the fact that we don't learn about this in school in all of our
Oh, no way.
disciplines, right? And
Totally.
I was at an interdisciplinary meeting last night, and it was really interesting. Actually, it was a pediatrician speaking, which is really always cool to me to see a pediatrician who's integrative and interdisciplinary. And he was saying that, he didn't learn about this. The other doctors he collaborates with have never heard about not even just tongue tie, but airway and
Yeah.
any kind of inflammatory disease beyond what we learn in school. So we don't learn it. We learn about structure. We learn in silos, and well, that's one of the you know, reasons and one of my motivations behind doing this podcast is to bring disciplines together, because we need to know what each other knows. We need to learn what each other learns so that we can bring it together for patient care. So I'm so grateful to talk to people like you who are also collaborating out of your profession, right? That's so
Yeah.
important.
Yeah. You know what? Was just in the office in Calabasas with Dr. Tanya Altman, who's a pediatrician who's integrative, and she totally has a cross referral with Dr. Elena Rumek, who's an amazing release provider and integrative dentist as well. And then Dr. Eric Galindo, he's been on your podcast. We've
Yes.
collaborated, and we cross refer patients, even though he's in Guadalajara. And
Mm-hmm.
he's an amazing pediatrician who really gets this. I'm focusing on pediatrician because it isn't that common to have
Right.
ones who not only get, okay, this exists, but ooh, how important is it to have all these different disciplines, from feeding and myo when they're older to, all the kinds of manual therapy and
Mm-hmm.
occupational therapy. It's a messy, amazing village we need, right?
Yeah.
To help people heal.
Right. That's a great way to put it. Messy and amazing. And growing and growing,
Yeah. Yeah.
So
Yeah.
tell me about your FMDI. Tell me about that, because
Yeah, it kind of came out of this need to I love deferring and refer. I mean, always IBCLC with babies, like that's point person, right? And
Mm-hmm.
midwives who also have some, remarkable training. I've always relied on, we rely on each other. Then when the kids are a little older, just after getting into this airway feeding field, relying on the myofunctional therapists and the SLPs and the OTs and yet when I started delving into this in my little city up in far NorCal, there weren't many people who knew about how to really truly discern and distinguish with what's going on in the body with these issues. So I kind of had to develop a village within myself. So my practice really comes out of an interdisciplinary model that now I still will rely heavily on referring and cross referring with lactation, myo, and all the kinds of therapists, osteopaths, physical therapy. But as a chiropractor, I also then learned a lot about cranial bones um, but it was nothing like being taught by my daughter because I
Mm-hmm.
needed to work on her to help her, that I started to see these patterns in the body that emerged not only with her with tongue tie and what that did with the body, but I started to see this on all the other babies I checked and after that. And then, once I knew about this whole tongue tie, lip tie, cheek tie, narrow arches, and then I started to check all the kids. And then quickly it became a required thing that any adult who comes in, we're going to check intraorally. So
Mm-hmm.
my appointment times grew, but also my depth of understanding of what people had going on grew. And I began to see these patterns that emerged that formed into a 70-point map where I saw when tongue tie exists or when narrow arches exist, when any things that happen in utero exist, it leads to these 70 areas in the body that contort, that misalign, that tense up a certain way between muscles, fascia, bones, organs, lymph, and glymph. But all that to be said, I that became a map. Now it used to be called the tongue tie map. Then I changed it to airway map, and now it's pharyngeal arch formation issue map, because that's really what it comes down to, is this phase of origin where we form. But what does that all mean? It just meant I merged together many disciplines to make a system where we could see when the floor of the mouth has this tension, what's going on in the entire body. Then it becomes these 70 points are crazy to navigate. So I distilled it down to 4 main areas. And I've been teaching providers this. I just had practitioners come out to Santa Barbara for a 2-day floor 4 training, which I taught in many states across the US last year. Then, for the first time, I taught my advanced system, FMDI, functional mandibular diaphragmatic integration. Well, the mandibular diaphragmatic is about the mandibular diaphragm, the oral diaphragm, the tongue and the floor. When those two have this dynamic tension, well, that affects the whole body, as we know. So then I found out, how do I pattern make this a way that we as providers can help people with these issues? And so if you navigate these 4 main areas and then it's a two-way street. So I feel so thankful that for years now I've seen the body has this connection, and we know this, but how do we tactically help these areas in the body to free the floor of mouth so that the tongue can move freely, so that babies can feed more easily, kids can regulate nervous systems and swallow and speak more easily and digest, and adults can not have that horrible TMJ, and relieve themselves of all of these stressors. So it's become my system that I've begun to teach on how practitioners, whatever their background is, can learn a system based on the floor of the mouth and how it works embryologically to help people. Because I think, I'll kind of end that statement with saying it's crazy how many people are walking around with these issues, that it's like well over 60% of people, are dealing with airway issues. I mean, there's stats that run higher, but I
Mm-hmm.
want to point out something that I'm like, it's wild that tongue tie, narrow arches, they start at that fourth, fifth week in utero, and then we start with tongue tie, lip tie, narrow arches. By the 11th week, 12th week, we have a chance for those tongue ties, lip ties, cheek ties to dissolve through apoptosis, cell division. So those of us who that happens for, amazing. We don't have these restrictions and our arches form well. But for the rest of us, we're stuck with those restrictions, and like me. But what I also want to reveal is, well, but you know what? We all start with these restrictions. So even though we might not end up with the lip tie, cheek tie, tongue tie, our body, our fascia, our system doesn't just automatically delete those tense points. I think this is why I see anybody who comes in the door, I've never seen anybody not benefit from having tension released in their mouth. But I'll take it one step further and say, but so many people, they're so sensitive in their mouths. So when I work with the body to free up tension in the mouth, and the mouth needs very little pressure, I see parents are so relieved because they're used to their babies having to have these uncomfortable maneuvers. So I always love whatever I can do to bring relief to people, especially the parents where their babies have these issues. It's a relief to me because I'm a dad as well.
Yeah. So that's a great explanation. And, you're talking about the 60%. That's airway disorders. There's lots of people who don't realize they have airway disorders, but consider themselves having TMJ or clenching or grinding, which is an airway disorder, but not diagnosed. So I think the impact of this is even greater. I don't think there's anyone that walks around in complete comfort and relaxation and not that tight tone. And, as I often say, and the way I explain to parents is this: if there's tightness somewhere, there's tightness everywhere. Does that make sense to you? Like that's my simple, I'm not a bodywork or I'm not a chiropractor. That's my simple way of explaining to parents why, if there's a tongue tie, we have to deal with more than just the frenotomy. We can't this is not a simple, quick snip. And the way you have learned from your children, I am applying what I know now to my grandchildren. And it's opening a whole nother world to me about the differences and the complexity and the individuality of treatment. But the tension is the same depending on the root cause. Have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, The Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear, and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net. The direct link will be in the show notes.
Yeah. And, I'll throw in another little, that's beautiful because, you pass on this knowledge, applying it to grandkids. And it's like, this is such wisdom that needs to be transmitted through family lines. One of my biggest honors is when I get to see, like the other day here, this family came to Santa Barbara from Phoenix, the Scottsdale area, to come as a family, 5 of them, husband, wife, and kids, to get care. So we did, 9 hours of body work for all of them total over 2 days. And then I had the parents at the beach for an hour integration session where we go through mindfulness and I teach them. Well, it's not me teaching them. It's us together journeying on how I can help them with integration practices. And the grandparents, though, were the heroes too in this because they brought the kids and they were with the kids the whole while the parents were in here alone to get their sessions. So superstar. But I've had the pleasure of evaluating when babies come in my wife always says this. She's like, Neel, whenever you say, she's like, I always get this picture when you say babies come in, the babies walk in the door on their own. The door opens, the baby throws
Here
off
comes
his
the
jacket out of the
baby.
couch. He's like, I'm here. This is funny. But the parents who bring the babies in, I evaluate them. Like I was in LA doing sessions and I saw the baby, and the baby had this retrognathic mandible, and I'm releasing the thyroid gland, that fascia on the organ to help the mandible come forward, and preparing this baby for a revision because the first release wasn't a thorough release anyways, all that being said, when I'm teaching a parent, I'm going to feel in their mouths with gloves and check them, and I'm going to show them this is how you can work with your baby. Do you see how when I release the thyroid, it frees the floor of the mouth? And they're like, oh, because they have the issues, right? And then I've had the pleasure of evaluating grandparents and even great grandparents. And whoa, this is the messy, beautiful, messy thing that's going on, and the beautiful thing that happens when healing can happen. But yeah, I think that the amazing thing that we have the opportunity to do is to support families because they're so but I wanted to mention too, with one of these babies in this family, there's tension, tongue tie, narrow arches. This is tension, but for there's definitely this like other end of the spectrum with hypermobility. We could talk about Ehlers-Danlos, but let's just get non-specific. I navigate in a journey with so many patients with hypermobility that it's a very different thing that's going on for them. Like this little boy, he's 1.5, and he has a hypotonic floor of mouth, meaning the posterior aspect of the floor of the mouth is too weak. So you feel in it and it's like very soft and supple. Well, then the anterior digastric, the front of the floor of the mouth, is really tight. But I just wanted to bring light to, while there's tension, that is a clue. Sometimes it's the lack of tone and that too elastic tissue that's going on when these people come in, and I'm seeing they don't have any tone. They don't have the strength in the tongue to get up there, to lift the back of the palate, to get the airway to open. So with them, at first I thought, why am I seeing this, and how can I help this? When I kind of fell into the flow of creating my floor 4, which just came out of purely seeing it work and seeing this method work. It was just when I found tension release in certain organs and it freed up tension in the floor of the mouth, it also brings tone to those floor of mouth muscles that are usually weak with hypotonic babies and kids and adults, and with hypermobile babies, kids and adults. So that's a difficult thing to journey, because those are the ones who come in and they're often told there's no ties. And you know what? I'm like, I know why they said that, because that submucosal tie is so negligible, but the hypotonic tongue, that tongue can't do what it's designed to do because of the body carrying the pattern. So I feel like whether it's tension or whether it's weakness, it's just like you said, who isn't walking around with these issues? There's so many people. We all need this help. And, I didn't know this, but even though my daughter being born with a tongue tie made me aware of that issue, I didn't realize that the whole year before then, when I was, um, you know, doing my movement and running and foam rolling and intuitive movement, that I actually taught intuitive movement around the world until that point. And then, or actually after that, but I was doing a lot of movements without even knowing it that were freeing up the floor of my mouth through head and back of tongue movements. So even though I didn't know tongue tie existed until my daughter was born in 2016, that whole year before that, I was unlocking tension with whole body movement. And so I ended up getting dramatic strength and healing that when I look back, I realize, oh, so many of those movements and those releases that I was doing with my body, they were what helped me. So I was able to take that and carry it forward and color my understanding as well of what my daughter needed and all the other people that
That's so
come in, what they
interesting.
need.
And when you say release, are you talking about a fascial release or a release of the bony structures? What is it, a
Yeah.
combination? What would you describe it as?
Yeah, as a interdisciplinary practitioner, I merge, let's say, like work with the joints, like adjustments like a chiropractor, although with babies it's very soft and gentle, and some with
Mm-hmm.
adults too. And as like more in my osteopathic work, I'm doing fluid movement, releasing the cranials with slow ease of releasing these patterns. And then with like, body work and manual therapy, I'm getting deeper into the myofascial strains that's pulling on my structural integration or Rolfing background of deep tissue work with the more adults who need that. And then, but still, all of it comes back to in the moment, I might see like, ooh, the fascia, that tissue related to that kidney is restricted. Then I might see, oh no, it's actually the kidney is malpositioned. And so that's a visceral, that's an
Mm-hmm.
organ release. It's still
Mm-hmm.
working through the fascia. But when I see that that kidney being out of alignment has affected the rib cage, then I'm working with the rib cage and working with the intercostal muscles. So I would say I get really specific because I do love fascia and all of us talking about it, and it's so important. But I discern, is there an organ that beneath that fascia needs to shift? And then I even talk, it's into the weeds a little bit, but I talk about the periosteum, which is
Mm-hmm.
that outer covering of the bone, because there's blood vessels there, and there's very specific work on the bone that needs to be done to help people's mouths free up in other times.
Wow.
So I would say I'm working with very different kinds of work on each person, and that could be visit to visit. But
Mm-hmm.
I'm looking, it's kind of like, what do I do? When do I do it? That's why some people, when they come get trained, they're like, what do you do? I'm like, well, first of all, we need to figure out what's making change in the mouth and in the whole body. So I base that on that, not a theory. But I
Right.
will go between all the tissues and all the different kinds of manual therapy that are needed in order. And when that doesn't, I'm like, when I'm at a stuck place, I'm like, sometimes that's when somebody's, the parent, or we delve into like what's going on emotionally in the dyad, or like those traumas and stresses. And
Mm-hmm.
so we can delve into that when time permits. And but often I leave space for that because we're multifaceted beings.
Yeah.
We're not just people with tissues that are tight, right?
Right.
We have like
Right.
all these things that happen. And so to allow that to be a focus too helps cover some of these other origins of why tissues are tense. But
Mm-hmm.
when it comes down to it, I'm really feeling specifically with what kind of release. Is it a soft, gentle organ release? Is it myofascial release that's deeper? Is it a joint that needs to be adjusted? Or is it a cranial that needs to be nudged? All those things
Mm-hmm.
come
That's
come into
interesting.
play.
I have been collaborating with a doctor of osteopathy who actually practices osteopathy, which is kind of rare. A lot of them go off to different medical specialties
Yeah,
and leave
absolutely.
their DO behind. And he described it similarly. He said, it depends on what needs to be adjusted. That's it. That's it. He answered me similar to the way you did. And he does amazing work. And I've used him for myself and my family. And it's similar and it's intuitive, which is
Hmm.
hard to teach. So it reminds me of what I have finally done. I'm a lactation consultant who I have so many people saying, can I come to your office? Can you be my mentor or whatever? And I had a hard time trying to teach other lactation consultants because I have a way of doing things that's a little different based on the midwifery
Hmm.
model a little bit more
Yeah.
and more family centered than actual lactation centered. And I finally came up with a framework. I call it the careful framework, which I'm starting
Hmm.
to teach it publicly. And the careful framework is me finally being able to put down what I do in my brain and in my heart and soul when I'm treating a family and how I follow it through. So it sounds like you're doing the same type of thing with you've been doing this thing and you had to figure out how to digest that in order to teach it to other
Hmm.
professionals. Does that make sense?
Yeah, absolutely. Yeah, and I
Yeah,
love that. And I
yeah.
love especially your background with, midwifery and lactation. I have one I've collaborated with that reminds me of you, younger, and and some things are different, but I loved that perspective that she brought because it's such a dynamic continuum between mom and baby. Of course, you as an IBCLC know this, and then you have even more with like seeing a woman, go through
Yeah.
this pregnancy and postpartum. So yeah, you're
And yeah,
obviously
and
very unique in
often
that.
one of the lectures that I give that's one of my most popular is what about mom? Because we often
Yeah.
forget about mom in this field.
Mm-hmm.
We have a lot of
Mm-hmm.
technical learning about the infant and the mouth and the laser and the this and the that, and we forget about that there's a family attached to that baby.
Yeah.
And there's the interplay between the mom and the baby. So practitioners such as yourself that can treat both sides is so important, because you can't heal the baby if the mom is in flight or fright constantly and is
Yeah.
stressing about things or carrying that trauma that you talk about. And there's so much birth trauma now,
Yeah.
which is really, really sad. Um, yeah. So I love what you're doing. And I feel that you sharing this with other providers around the world will definitely be good for the people that they treat as well. So thank you for doing that.
Oh, it's such a privilege. I knew that there's just too many people out there who love helping people heal and cross pollinating with other practitioners. It's like we the more we team up to collaborate, the better. And then I feel like I was given these keys. They came to me. It was like, yeah, I recognized through pattern recognition these, like you said, putting something that you do in your mind in your practice. How do you? Then I started putting it onto paper or documents, and I'm like, oh, wow, I'm seeing this pattern exist with patients countless times. And then I started to be more aware of what am I doing in this case to help someone. But for me also, like that came later. I think when I have a parent with their babies in the room or kids or themselves, I'm trying to figure out what I can do to help them. But at the end of the visit, like I might see them again and again, or this might be the one time that they can
Mm-hmm.
come in for various reasons. Whatever it is, I try to end the time with what can I show them to bring change if they do this, like with a baby and they want to prepare that baby for the release or post-operatively, or let's just separate it from a frenectomy and just say that that baby wants to feed better. The parent wants to, that's going to be the baby. The parent wants to help this baby. There's a hypersensitive gag reflex, and I figured out how to remove it. And I'm like, yeah, but we don't know what will happen if 2 days, 3 days, 4 days go by. You may start to see that some of that hypersensitivity, but I'm going to teach them how to free the thyroid. I'm going to teach
Mm-hmm.
that parent how to unlock that area of the body that I've found that relates to the success in the visit. And we put it on video. They video it. They can take the video with them. They have it. Then they can watch it and they can repeat it. And I've had so many parents who come in and they show me what they're doing, and I'm like, wow, you are so good. Like you are a body worker. You're a parent as a healer, right? So I
Mm-hmm.
I think through doing that as a practice over and over with so many people, it was really seeing patterns even emerge out of that, where I'm like, you know
Mm-hmm.
what, every person's different. I'm still going to do that with everybody that I see, but there are things that are very repeatable that I can train other people in to help them not only do the things that I'm showing them to do, but kind of like you alluded to, I have clinical intuition as what I teach in my trainings. You could call it intuitive empathy, or there's a newer term called kinesthetic empathy. But because I work so deeply out of a place of feeling, sensing, knowing, by now it's just a really subconscious process. I had to practice that decades ago and a decade ago. And so I teach people how to go into that place of being very clear, very receptive, and listening with their mind and with their fingers to use that mixed with their clinical skills to figure out how to work in a way that's very tactical to accomplish certain means. So I think that part of my training is really not here, do this thing. It's really, how did you arrive at that conclusion? So I have them understand when people shadow me or when I'm teaching them, how did we get to this point? right now, where this just happened with that person on that table, which is unmistakable, where they see the shift in tension in the person. And then we just problem solve that. But yeah, I get such a joy out of teaching. I'm going to be, I think we mentioned this, I'll be at the Myosphere, which is end of April, presenting to other practitioners. But then I'll be taking the training that I'm of my floor 4 in FMDI to Infinity Centers, which is a neuromotor institute ran by a chiropractor, Dr. Josh Madsen. But he has a team of over 25 practitioners, SLPs, OTs, body workers, and I'm teaching the entire organization, their offices that are based in Iowa, but Minnesota, Denver, on how to implement this. Because if they can get this as an organization, I just think it's going to be really amazing how many people come from all over the world to that center. They focus on neurodivergence, autism, and they use photobiomodulation and lasers. They're seeing extraordinary things happen, but they want to bring in, how do we know how to get to this place where the nervous system regulates and the tension regulates, so we can see more progress. And that's where my floor 4 and FMDI come
Wow.
in, is really to help. I think I'll just mention that one other part of it. I'm talking a lot about tissues and releasing tissues, but in the nervous system, when it's amped up and when kids have a hard time, or us adults regulating, I deal with that. It's not even that we need just the body to melt. We do need that. But sometimes we need not even the nervous system to allay and that fight, flight, fawn, freeze to just get out of a different mode. We need our minds and our whole frame to be able to exist differently. So what I see happen after the floor 4 is done is that bodies go into a phase shift where not only do the calf muscles turn to butter on babies, kids, and adults, the hamstrings loosen dramatically, the inner thigh muscles, the SEMs, the floor of mouth, and the face and the head. But people go into this state of bliss, or just like release of tension, to where their mind can perceive different things. And so when I journey with people, practitioners, teaching them how to do this, or parents how to like work with their babies, I'm like, we're looking for that state where a big change has happened. I'm not putting a lot of expectation on them. They're like, Neel, I'm not a body worker. I'm like, you might not think you are a body worker, and you're not, but you, at the same time, you have hands that are designed to care for this baby, and you have intelligence in those hands. So you know so much. Even if your mind doubts you, trust what you're feeling is something beautiful and accurate to some extent, and trust that, because not only are you going to find that you're better than you think, you're going to do it, and then your mind will catch up to your body, and you'll see people that you'll find little baby's going to be easier with that feeding or that struggle that you're having.
I think trust, I jotted down a couple of words, and you just saying trust. And I think that trust interplays a lot between parents and babies. And a lot of the fear and anxiety that mamas have comes from not trusting their own instincts about their baby.
Yeah.
And that could be about any aspects of infant care. You know, everybody's looking to that outside person to tell them, the authority to tell them what to do for their baby. And it might not be the best thing for their own baby, but they're afraid to do, because they're not trusting their own instincts. They're afraid to follow what they feel is right for their baby, because someone who went to school and has initials after their name said, don't let your baby lay on their stomach, or, you know, something like that. So the other word that you said was that you listen, and you were talking about listening with your mind and with your hands. And I feel that excellent listening skills is something that is missing from a lot of healthcare providers' toolbox. You know, where we have, in general, you go to a doctor's office and you have very little time with them, and the doctor has to get to the next thing. They don't have time to listen. And that's a skill that if we could listen, and I modeled this in my own practice, and for my clients, I always say to them, tell me your story. You know, and when I was in person, I always had a tissue box there, because nobody's asked them their story. You know, how did you get here? Tell me about your pregnancy. Tell me about your birth. And nobody has asked them. really, except for the, is it a good baby? Those are the kinds of things they ask. So really listening to the story, and if it was what they expected it to be, and holding space for their experience is healing in itself. And it sounds like you're doing similarly. You have the hands on as well, which must release that tension. So this is all just so fascinating to me. So thank you.
Yeah, no, absolutely. It's a privilege to journey with people just outright.
Yes.
But then,
Yes.
yeah, and especially in that sacred place of like if when a family comes in, they just had their baby, and it's a privilege to be able to just be with people. I mean, I really enjoy that. And then I have the added benefit of being able to lend help and facilitation to their healing. I mean, that's why they're
Right.
coming in. So obviously
Right.
I always tell them, I'm like, I could just hold your baby and we could just hang out, but I know you're here for me to help you with more than that. So let's do that. But it's, just such a beautiful
I mean,
thing.
even something as simple as a baby's upset and mom is upset. So the baby picks up the mom's tension, and I'll say, you know what, let me hold the baby. And I'll do whatever it is that I do. I've been taking care of babies for a really long time.
Yeah.
So I have an intuitive how to hold the baby, how to calm them. And I was the oldest of my own siblings and my cousins, and we were all very close. And so I was always, I've been babysitting since I was like 10, which is ridiculous, but I have a touch with babies. Wow, and the parent will turn to me and say, wait, what did you just do? How did you do that? And I'm like, well, I just listened to the baby, and this is what they needed, and look, and breathe with them and calm them down instead of like trying to figure it out and, oh, what's wrong with my baby? That doesn't help. So yeah, it's really cool. And it is an honor and a privilege to have a family trust you as well, right? Like it's not, especially when you're doing things a little outside of the box, to have the trust of the family it's amazing. I keep saying that word amazing, but it really is. It keeps coming back to that. So one thing that I did want to ask you is, are you able to help a family make a decision about whether a surgical release is necessary? And if so, what do you base that on? Because that's still the trick point for me and for many of our colleagues. How do you know, is this really necessary? What will happen for those borderline? There are some that this baby can't nurse, this baby can't open their mouth. And then there's others that are having little functional issues, but not so bad, but what's going to happen and all that. So tell me how you deal with that.
Yeah, I mean, it is a very, like when you take it seriously and when you really hold, which you do, and I'm speaking to that part to say, when you hold it with a lot of weight and there's complexity involved, that's how it gets harder and harder and harder to help. Because if we make a snap judgment and we're just like, oh, black and white, that's it. And it can be it could sound easy, but you're also adding in when families have a certain way that they think about this. And I'm not saying, there's so many families who come in and they're open to my opinion. They're like, you just tell me what you think. And I'm like, I do want to tell you what I think, but you're here for that. But what do you think?
Yeah, that's even more pressure when they trust you implicitly.
And voice. Yeah. But I am referred to by so many people, meaning like I usually come in at a place. Some people come to me before the release, and that's great. I do that. But a lot of times I'm somebody people get to when a lot of other things haven't gone well, because I'm a specialist that has we could just say it's not as easy to get to me in all of those things. But I do travel. I do travel to places to see babies, especially. But I try to rightly defer and refer to point people in their lives. Like if an IBCLC has journeyed with them, I try to defer to that one or the release provider or to the myofunctional therapist, whoever it is. But yeah, as we are a team trying to decide these things, somebody says, what do you think, Neel? The provider might ask, what do you think? Are they ready? And the family's trying to decide, Are we ready? Do we need it? Do we not? And I try to look at a few things to help me know more. First of all, I see them once. Then I say, let's have you do these things at home. Come back again, because I'm going to see how that all worked, what helped, what didn't, where we're at, what other issues emerged. That'll give me a lot more understanding. And some people, I'm like, I still don't know. I think a third session, we're going to know a whole lot more.
Mm-hmm.
There are complicating variables to that. And I'll mention two, because I evaluate this on everybody, because I think they matter hugely to this topic that we're talking about. Sure, the floor of the mouth and how it's doing, but diastasis and also a retrognathic mandible, especially with a baby, but it's with adults. If there's diastasis, ab separation, that's there, not just postpartum moms, but everybody's born with ab separation.
Mm-hmm.
The abs are separated. They haven't come together developmentally. Stanford has this great article that says most kids will have their abs cohere and integrate and come together at the age of 5. Well, yeah, that might say most, but I've seen 80-year-old men who've never had their abs come together because there's this big valley between.
Mm-hmm.
And that is going to create so much collapse of the torso and the structure that it'll restrict the sternum, the hyoid, and the mandible. So I'll pan out and make this like a very simple statement at the end here, but that is important. If I'm working with a baby, kid, or adult, I really want to make sure that we're addressing the diastasis, because if they go get a release before that, that's where it's harder. That's where the hyoid gets stuck, the mandible doesn't come forward as much. So then the other part is maybe they don't have ab separation, but they have a retrognathic mandible. They expect the release to take care of that, or they expect most bodywork to take care of that. But I'll say, yeah, but has the thyroid ever been released? Has the parathyroid been released? I look at the nitty gritty here. Has the hyoid been fully released? Has the sternum been fully released? And I'm asking myself these questions because I didn't know this 6-7 years ago. And once I figured this out on babies, kids, adults, I started to realize, oh my gosh, how many people, it's like tongue tie, right?
Right,
How many have I
right.
missed that on?
Right.
This is even deeper down the rabbit hole of,
Yeah.
so I'm trying to clear these things and say, you know what, in this case, I know what I'm looking for to help bring relief and symptomatic reduction and better feeding, less
Mm-hmm.
gagging, better quality of swallowing and these things. So I'm going to focus on that because that's within what I know for
Mm-hmm.
sure.
Mm-hmm.
If you're looking to me to say, do you think this is necessary? I'll say, well, also I'm going to do what I'm doing, and in a couple sessions, I'll know a lot more. But I
Mm-hmm.
also say, if I see the same things tense up and I'm addressing all these variables, which is, there's a lot to address, and that's repeating, I'll say to the parent and say, I don't want you to be in a situation where you're relying on my body work, because I can only remove
Right.
compensations and symptoms. I can't remove the ties.
Right.
100% not possible.
Right.
So if we play this out and we do too much body work before you get something that could be necessary, that's unnecessary money. And it's
Mm-hmm.
also not necessarily helping out. But on the flip side, I'm a big person on saying, let's make sure things are clear to a certain extent before people rush in, because I'm usually able to help remove urgency, where baby
Mm-hmm.
begins to feed really well, where
Mm-hmm.
things improve so much that the parents are like, do I even need to? And I'm like,
Right.
let's not go there. I'm not removing the need at all
Right.
for this. I'm removing urgency. So now let's talk to the other providers. I'm going to talk with lactation. I'm going to talk with everybody else so we can huddle, at least in a text,
Right.
to see what needs to happen. Because I think there's too many variables for me to decide something. And so I really try to make it not about me and what I think, but about, here's my opinion. What do you think?
Right.
And
The
let's see what
total
everybody
team
else thinks.
approach, which is something I preach all the time. And I
Totally.
appreciate and respect your view of, if there's a structural defect there, all the body work in the world is not going to melt that away. Right.
No,
So, and you're
definitely not.
also helping me. I have a case in my head right now as you're talking.
Yeah.
That's helping me decide how to advise these parents who are saying, Lisa, we'll do whatever you want, which is always so stressful. Like, no. I want you to learn this and this and this. And then you tell me what you think you should do, because it's not my baby, But the practitioner that they're working with has said, I've come to a point where, just like you said, I'm doing all the body work in the world, but there's this tension there that's not going away, and maybe we should release. And then I was struggling with it, because I'm saying, but functionally, I go down, the baby's feeding well, there's no reflux, they're gaining, mom doesn't have pain, all the things. And like right now, functionally, this kid is okay, but maybe this kid is okay, and this baby is okay, because of all the great body work that she has had, and this can't continue if the person doing this excellent body work is saying to me, you know what, this is obstructing things a little bit. So you just clarified something for me. Thank you, Dr. Neel.
No, that's good. You're always I'm sure that lends credit to also you're just always leaning in to try to help people and try to figure out how you can be there more for other people.
Yeah. So and I never want to, especially, and I tell this to the people I teach now, we have to be more careful than ever, because our field has been under a microscope, especially dentists with lasers and IBCLCs, for this tongue tie fad, quote unquote, that we're, making all this money on, which is like a joke. But, we've been accused of a lot of nasty things, and we have to be really careful, really, really careful, not just to protect our professional reputation, but to protect the patients who we're caring for, because they're vulnerable, and they do look to us for the best answers. Anyway.
Yeah, and it's important. And one of the, and I do really think that we can. It's a very, very tense, terse tightrope walk line that we have as practitioners. People are coming for expertise, so we don't want to withhold. But at the same time, what we know certainly, I think it's really amazing to relay that with certainty and confidence. And I try to do that. I'm like, hands down, that thyroid gland, when it released, it freed up tension in the floor of your mouth. And whoa, did you see that the little baby's mandible come forward? And they're like, yeah, that I know 100%. And if a mom feeds baby right after and she's like, there's way less tension, there's way less chompiness, clampiness, I know that I helped the latch in that moment.
Right.
And I hope the mom texts me or we check in next week or 2 weeks later, and they're like, it has been so much better since then, whether this was before the release or after or separate. So I say, I confidently know that situation was helped and the latch. What I'm not at all saying is like, oh, that baby's body became free of the, tongue tie issue. We just improved one thing, and I'm going to speak to that with certainty. But I think it's also people come saying, we just want, people are learning more about this whole pharyngeal arch of the mouth and these issues, and there's a lot more people that have gone down this rabbit hole, and they're like, now we know, wow, there's so much to explore. So, I do think I have a really huge desire to bring more understanding to people, not just practitioners, although we need to. So my floor 4 that I mentioned is going into like the Infinity Centers, and then talking with other people as well in the dental and myo and airway feeding world about it becoming a screening and also a protocol that can help us know, are we really ticking things off the list with manual therapy or even with guided things like when we're guiding with lactation and myo. And that's really exciting. But I also have an arm of that's for just the layperson, for the parents who want to know this, because they might not ever get to anybody. And but then I also have a webinar coming up in May that's called the Cosmic Mandible. And I say cosmic because
that's cool.
I have a huge appreciation for astronomy and space, this uncharted territory that some of us are unearthing for patients. And also I teach a lot of embryology and how we form influences not only who we are today, but how I, as a manual therapist, know how to help people. So in that, I'm really going to be telling a lot of the parents and the people, that are in mandibular advancement devices, or they're going through procedures like orthodontic surgery, or they're in expansion, all the way back to these mandibles that are stuck like that. And, and I have seen a very clear course of nurturing with alignment and exercises to help that mandible glide forward. And because I've seen so many babies in the last, like, I'd say 3 years specifically, I think the instances of retrognathic mandibles are increasing. I've talked with Kevin Boyd about this recently and some others. Um, I think there is a correlation, but I have suspicions. But what I know is I am almost always releasing their sternum and their thyroid. And that is one of the biggest ways I see these mandibles come forward. So I'm really excited to teach practitioners about this, but that's going to be in the floor of 4. But I'm going to be teaching a webinar on the cosmic mandible to show parents and people how we can bring these mandibles forward. And I guess I'll say, because so many of them come in after having a tongue tie release and expansion, and that jaw is still stuck back.
Yeah.
So they think they need to result to more surgery or mandibular advancement, even though mandibular advancements are really good. But I have seen people come in with MADs, those mandibular advancement devices, and it's pulling against restricted fascia and organs. So when I find that I can release that in these areas, that process happens more easily. So I'm decoding and demystifying this jaw that's stuck back, that retrognathic mandible, and how people can really find there are simple but deep ways to help this come forward so we can get more air. Or for a mom, right? They're not looking, mom and dad, they're focused on air. They want their babies to breathe. Who doesn't? But it's feeding, right? It's the gag reflex sensitivity. It's the feeding. It's the
But if
issues
there's
with
a
that.
retrognathic mandible, feeding is difficult, and that's
So difficult.
this runs in my family. So you're talking very near and dear to my heart when you talk about this. And I've been recommended to have the surgery, and it's not something it's not accessible.
We got to get together. We got to get together.
Yeah,
I got to free up some of these areas with you. That would be amazing.
Well, on that note, Neel, I've taken enough of your time. I really appreciate this conversation, and I am sure my listeners will be fascinated. Let us know. I'm going to write it in the show notes, but for those who are driving while they're listening, tell us how's the best way to reach you? What's your website, etc.?
Yeah, so my name is Neel, Neel, and that's the first part of it. So you can Google Neel, but then floor of the mouth, Bulchandani. So it's neelbulchandani.com. But if you look up, like I said, Neel, floor of the mouth, I'll come up. And, by the way, that name means the color of the sky in India. In India, that name means blue sky, but it also means the number 10 billion. So some people might think my name is Neil, Neal. So find me there. But Dr. Neel Bulchandani is my Instagram account. A lot of people find me that way. And then, come on over, check out the website, and you can feel free to email me or reach out on Instagram, and I'm happy to, or Facebook, just at Neel Bulchandani.
As well. And like I said, it'll all be in the show notes.
Yeah. Oh, yeah. And we mentioned this. I have a podcast called Compromised to Alchemized. If you want to check out my podcast, it's called Compromised to Alchemized. I love that. And we'll be having you on sometime soon.
Excellent. Thank you so much. Bye-bye.
Thanks so much for having me on.
This podcast is meant for education and conversation only. It is not medical advice and does not replace formal education, professional training, or individualized care from a qualified healthcare provider. Always seek appropriate guidance for individual concerns. The views and opinions shared by our guests are their own and do not necessarily reflect those of the host or tongue tie experts. Many professionals were never taught how to fully assess tongue tie, and families are often left trying to reach their breastfeeding goals without the support they actually need. If feeding feels harder than it should, I don't want you to be alone. I wrote Tongue Tie for Parents to help you understand what's happening and how to move forward with a clear, thoughtful approach. It's the same guidance I would give you if you were sitting with me in my office. It takes a holistic, functional view, guiding you through what to look for, how to think about next steps, and what actually helps. Available now on Amazon. Link is in the show notes.